Our presentation is over the respiratory system.
What is it? It's a set of organs that are responsible for breathing air, absorbing oxygen into the bloodstream, and breathing out carbon dioxide. This includes the nose, the pharynx, the larynx, trachea, bronchi, and lungs. Here are a few definitions. So the trachea is the main windpipe, and it starts at the back of your throat. The bronchi, there's two of each, one in the left and one in the right. Each are separate from the trachea, or each separate from the trachea into each lung. Bronchioles are tiny tubes which split off from the bronchi, separating and extending all throughout the lungs. The alveoli are tiny air sacs that are connected to each bronchiole, and as the blood passes through here, it turns the fresh oxygen into carbon dioxide to be exhaled out of the body. Lastly, there's the diaphragm, and it's the primary breathing muscle which is located at the base of your chest. Here's how the gas exchange process works. First, it starts out, the oxygen, along with other gases, enters the body through the lungs. Second, while in the lungs, the oxygen is carried throughout the bloodstream. Finally, carbon dioxide is collected by the red blood cells and then makes its way back into the lungs. From the lungs, it is transported out of the body as we exhale. Here's a normal set of lungs. They're usually about 10 to 12 inches long. It's a pinkish reddish color. It's a sponge-like material. The left lung is smaller than the right lung, and the left lung also has 2 lobes, and the right lung has 3 lobes, and the ribs are there to protect the lungs. There are a few normal changes in the respiratory system. This includes decreasing in airflow and gas exchange, decreases in vital capacity, weakening of the respiratory muscles, and decline in the effectiveness of lung defense mechanisms.
Here are going to be some chronic and common diseases. These are chronic obstructive pulmonary diseases, COPD. They are chronic progressive. They involve trouble breathing and high risk for acute lung infections. First one is bronchitis, and it's irritation, inflammation of the lining of the bronchi. It's usually caused by cigarette smoking. Some symptoms are coughing with the bringing up of mucus, breathlessness, wheezing, and some treatment are to stop smoking or medications. Emphysema is another one, and it's a chronic disease of the lungs. Some symptoms, again, are coughing, breathlessness, and rapid heartbeat. Some treatment is managing the pain and symptoms, oxygen therapy, and medications. Here you can see the mucus in the bronchi, and it shows you where they're located on the lungs, and it compares it to the normal one. Over here, the alveoli and emphysema are compared to the ones on a normal person. Another chronic and common disease is asthma, and it's a chronic inflammatory disease. Respiratory system is hyperactive to infection, cold air, irritants, or allergens, and the bronchi become irritated and constrict, which makes it difficult to breathe. And it's an unknown cause, and it may be because of family history, certain environmental exposures, and treatments are medications and sprays or inhalers. And on here you can see a normal airway, and then there's an asthmatic airway, which is a little bit more constricted. And then there's an asthmatic airway during an attack. So it compares the difference of all three. And on this diagram, there's relievers, controllers on top, and then preventers, and the combination of those ways it's drug therapy for asthma. Bronchiectasis is when bronchial tubes are abnormally enlarged, and this is permanent. And it can develop during childhood or later in life as a result of chronic infections and inflammation. Common cause is cystic fibrosis, and some symptoms are chronic coughing, thick white or green sputum, pneumonia, weight loss. Some treatment is controlling infections, preventing complications, antibiotics, and postural drainage. And on here they compare a healthy airway in the lungs and compared to the ones with the illness. Lung cancer is another one. It's growth of abnormal cells or tumors in the lungs. Some symptoms are chronic coughing, bloody sputum, shortness of breath. And the treatments are surgery, chemo, radiation, and targeted drug therapy. And in these lines, you can see all the different parts, and right here is a cancerous mass in the lungs. Tuberculosis is another one. It's abbreviated TB. It's an airborne disease, and it's highly contagious lung disease because it's caused by bacterium from mucus droplets. And the symptoms are coughing, shortness of breath, fatigue, weight loss, bloody sputum, and low-grade fever. It's usually cured by prescribed medications. And on here in this diagram, you can see the droplets from a cough or sneeze by an infected person, and they go, this is coming up, the bacteria is coming up, and it's going into the airway. And lastly, it's upper respiratory infection. It's commonly called a cold, and it's caused by a viral infection of the nose, sinuses, or throat. And the symptoms are like regular sore throat, fever, fatigue, nasal discharge, sneezing. And it's just usually treated by your immune system and by resting fluids. Here are resources. That concludes our presentation.
Great.